So there are a few differences between the cadaveric and living donor transplant. Now, these are very important when you consider which kind of transplants do you need. Cadaveric transplant in most centers in India, the waiting time is between 3 to 6 months. For living donor, there is no waiting time. As soon as the donor is ready and you have the correct permissions, you can go and do a transplant. Now, this 3 to 6 months is different in different parts of the country. Some places like Mumbai, it'll be around 3 to 4 months, maybe more if it's a common blood group. Some places in the north of India, they will have a longer waiting time. But the cadaver transplant is an emergency, so you need to be able to reach your hospital in about 4 to 6 hours. So places which are very well connected, patients then can go back and stay in their places. If they are not very well connected, then they may have to stay in Mumbai for some time before they can get an organ. Living donors is not an emergency. It's a completely planned procedure. You select the day, you select the time, and you do the procedure. The organ quality in cadaveric transplants are usually unpredictable because although they are of good quality, but because patients who are donating their organs at the time of death are usually elderly and usually have diabetes or any heart problem. In living donors, the organ quality is excellent. Cadaveric transplants are preferred for patients who are either very obese and there is no suitable donor in the family, or a living donor is not available. And living donors are preferred for patients with acute liver failure, patients with liver cancer or HCC, and patients who are very sick and who cannot wait for 3 to 6 months. For cadaveric transplants, the donor risk is not relevant. For living donor transplant, there is a 0.2 to 0.5% donor risk, which is very minimal, but the family or the donor has to accept because it's a voluntary procedure which the donor doesn't need, and the donor is giving it for their own loved ones.